You're welcome to yet another episode of Easy Access to Healthcare for All, a program which keeps you abreast of its strides in moving Nigeria towards attaining universal health coverage. My name is Aisha Muhammad Ahmed, your regular anchor. With the recent signing of the National Health Insurance Act into law, the NHIS is now to be known as the National Health Insurance Authority. The Executive Secretary is also now to be addressed as the Director General. This is just a tip of the changes that the new act brings to the implementation of health insurance in Nigeria. It is in the light of this that the scheme organized a 3-day retreat that brought a convergence of players at different levels to do a clause-by-clause analysis of the new law to help deepen the understanding of participants and enable its implementation amongst departments across the scheme. Let us bring you details of this retreat in today's package, highlighting the inclusions and steps the scheme is taking to make a smooth transition, among others. Keep watching.
Easy access to quality healthcare for all. NHIS.
First on the program is a highlight of events around the NHIS. In the news, new NYSC DG appreciates the role of the NHIA in the health and well-being of core members, just as the Pharmaceutical Society of Nigeria visits the Health Insurance Agency at its headquarters in Abuja. Stay tuned for details.
The new Director General of National Youth Service Corps, Brigadier General M.K. Fada, and his team recently visited the National Health Insurance Authority headquarters in Abuja. This was on Tuesday, the 7th May 2022. The visit was to appreciate the authority for partnering with the NYSC, especially with the onboarding of core members into the health insurance space. The NYSC Director General, Brigadier General Fada, stated this when he addressed the management team.
We come to appreciate you for the effort and the commitment for the successful takeoff of enrollment of core members in National Health Insurance Scheme. Thank you very much. As a follow-up, we are on our part committed to the MOU that was signed earlier before I took over as the Director General NYSC. Rest assured that all what MOU agreed on is bound on us, and we will redeem all what is in it.
In response, the DG NHIA, Professor Nasir Sambo, said the enrollment is in line with the authority's mandate of achieving universal health coverage. He promised to make sure the program is carried out without hitches.
I'm glad that the NYSC is the second, not the third, that has come, in the sense that it is a new organization that we have just entered into collaboration in order to deepen our drive towards attainment of universal health coverage. And we ensure that nobody is left behind in the process of joining the health insurance for attainment of universal health coverage. And I assure the new DG, the coverage of the members of the core members is now on course. And I always discuss with the general manager and his team to ascertain if there is any problem with respect to this newly introduced exercise. And if there's any problem, we'll sit down and brainstorm of how to ameliorate it.
Management of the National Health Insurance Authority received a team from the Pharmaceutical Society of Nigeria, PSN. The visit is to foster partnership between the two bodies because pharmacists play a vital role in the implementation of the health insurance. The PSN team was led by Professor Cyril Usifo, Chairman, Abuja chapter of the association.
What's happening in the UK and even...
In his remarks, he commended and appreciated the management for the reforms put in place to enhance drugs administration under health insurance, while also putting forward some requests on behalf of the association.
One, the baseline for pharmaceutical services approved by the Federal Ministry of Health through her agency in charge of pharma practice, that is the Pharmaceutical Council of Nigeria, to be the minimum acceptable practice adopted for patients accessing healthcare. We also seek to innovative alliances that will see prescriptions flow from the NHIS, accredited community pharmacies, as majority complain of dearth of prescriptions to their pharmacy.
The Executive Secretary, Professor Nasir Sambo, in his response, acknowledged that drugs and medicines are an integral part of health insurance, the administration of which can improve through partnership with relevant stakeholders.
For those who have studied health system and know the building blocks of the health system, it will be very clear to them that drug is one of the most sensitive indicators in the healthcare delivery system. A study has been conducted by World Bank long ago, since when I was a resident doctor, that where a facility runs short out of drug, it stands a risk of losing more than 70% of its clientele. That underscores the value of drugs in the healthcare delivery system. And the major custodians of drug within the healthcare delivery system are the pharmacists.
On issues raised by the PSN, Professor Nasir promised to look into them.
What we do is to ensure that we give every professional level playing ground. And I also cherish I didn't even know that you know that we have done employment, and we have considered pharmacists in our employment drive. And I'm even resting you assured that with the increase in the mandate and scope of the National Health Insurance Scheme, we will need more professionals within the system. And when we are doing that, we'll definitely bring more pharmacists into the National Health Insurance Scheme, so that we can have a good mix of the human resource that is required to drive health insurance to its very good destination.
The program is easy access to healthcare for all. The 3-day retreat held in Abuja was an avenue for players within the scheme to have an in-depth knowledge of the National Health Insurance Act as a law binding on all Nigerians and Nigeria. It brought together members of the management team, zonal coordinators, heads of divisions, medical personnel, among other groups, so that they can appreciate and understand the new clauses in the law. In this episode, we'll bring you details and highlights from the just concluded retreat that held in Abuja. Please don't go away.
Easy access to quality healthcare for all. NHIS.
On the 17th May, President Muhammadu Buhari signed into law the National Health Insurance Authority Act. This is a giant stride for the authority, as it has strengthened its regulatory powers and widened its scope of coverage. Towards this end, the management of the scheme organized an expanded top management committee retreat that brought in members of the management team, zonal coordinators, heads of divisions, medical personnel, and other critical players. The objectives of the retreat include deepening the understanding of the NHIS Act to make a well-articulated roadmap that will fast-track its implementation, to review the Act through a comparison of the content of the NHIS Act with the NHIS Act, to appreciate the implications of the Act on the operations of the National Health Insurance Authority and its stakeholders, to align the new Act with the strategic plan document, etc. The retreat, which held in Abuja, commenced with an opening remarks by Asma'u Muhammad, who heads the Department of Planning, Research and Statistics. She stressed on the objectives of the retreat and urged everyone to put in their contributions for its success.
It is expected we would have deepened the understanding of the contents of the NHIA Act. So it is a sort of capacity building, and that is what it has informed the expansion of the TMC to include all heads of divisions in the departments.
As a background, the retreat started with a presentation tagged The Journey to Mandatory Health Insurance in Nigeria. In the paper, the GM in charge of legal department gave a background to the old NHIS law and series of activities which led to the enactment of NHIA bill, then its signing.
We didn't derive satisfaction with the provisions of the 2004 law. We did not. It was because several factors, ranging from constitutional provisions to voluntary health insurance, and culminating in reluctance by states to key into the NHIS or collaborate with us. The powers were not so much, and we could do little.
A presentation on highlights of the NHI Act 2022 was also given. This took the form of a comparative analysis of the old and the new law alongside 28 dimensions.
Section 1 of the NHIA Act 2022 establishes the NHIA. Our name has been changed in the course of the establishment from NHIS to NHIA. We know what it means to just undertake or control a scheme and to be an authority. Functions are wider. Even before now, we were in 36 states of the Federation. That position is maintained, but with wider regulatory functions.
Some highlights of the NHIA Act 2022 include change of name from National Health Insurance Scheme to National Health Insurance Authority because of its wider functions. Objectives of the authority are more defined to promote, regulate, and integrate health insurance schemes. To ensure that health insurance is mandatory for every Nigerian and legal resident to boost the achievement of universal health coverage. Development of operational guidelines and review at least once in 5 years. Establishment of Vulnerable Group Fund, and many more. The key activity during the retreat was the clause-by-clause analysis of the NHIA Act. Each section was read, analyzed with observations made on each clause to boost its implementation and linkages across departments within the scheme.
There is elation within the...
At the event, the Director General, Professor Nasir Sambo, said the retreat was well thought out to bring in the expanded management to help in the implementation of the new act.
I mentioned 3 things that we did in this retreat. First, to appreciate. 2, to do clause by clause. 3, to deconstruct the bill for the purpose of developing operational guidelines for implementation. So exactly what you say, this is one of the aim of this retreat. And you will see that there is elation within the members, because we have taken every issue one by one and we have discussed how it is going to be implemented. So now is to see how, because we don't want to do it alone. Health insurance has so many stakeholders. We will now bring all the stakeholders to begin to have a conversation that will culminate into development of the comprehensive guideline for implementation.
The significance of the NHI Act can never be overemphasized, as the GM Legal Department explains.
If you go around the world, you will agree with me that countries that are operating health insurance, they make it mandatory for their citizens. But in Nigeria, we made it optional. And for this reason, people had the choice of participating or not. It affected our pool because health insurance, like every other insurance practice, is based on your pool, your resources, you'll be able to, which you will be able to use for everyone that comes into the sector. So because we made it optional in the other law, which is the NHIS law 2004, Cap 42, laws of the Federation of Nigeria, Nigerians were reluctant to join.
For participants, the retreat was quite engaging as they made suggestions, contributions, and deliberated on issues that will move the authority to a higher point.
Welcome back. In this segment today, we interviewed participants at the retreat who are drawn from top management staff, zonal coordinators, heads of divisions, alongside medical personnel who are implementers of the new Improved Health Insurance Act at different levels. Let's hear their perception of the retreat as well as the new act. Oluwafemi Akingbade, zonal coordinator of Lagos, shares his thoughts.
First and foremost, the joyful part is the part that actually now enables us to enforce health insurance in the country. What we had before was not mandatory, but what we have now actually mandates that every resident in the country must be under one form of health insurance or the other. And now, in the law, it gives us enough power to be able to regulate what goes on in the health insurance sphere.
Ms. Asma'u Mohammed, GM Policy Research and Statistics, stressed the significance of the retreat.
There are some few changes, additions in the new NHIA Act, which was not hitherto in the old NHIA Act. And so management felt it was really necessary for all actors within the NHIS to come together at this retreat for us to dissect the new NHIA, familiarize ourselves with the contents so that at the end of the day we will be able to make adjustments into our operational guidelines. Of course, after this, with the new NHIA law into being, definitely some aspects of our operations are going to change.
For the GM Special Duties, Mr. Ayo Osinlu, he believes the signing of the law is an avenue to achieve universal health coverage.
The new law that has just been signed for the National Health Insurance Agency, you will agree, is entirely a watershed, a new beginning, kind of a fresh window in the efforts of the country towards the attainment of universal health coverage. And what the law intends to do is to mobilize every platform and every opportunity and every player to ensure that ultimately all hands are on deck to be able to attain universal health coverage. Critical among all these stakeholders are the state governments and the states around the country. So what we are therefore envisaging is that we will need to galvanize the states to be able to bring up their energies so that they can join efforts with the National Health Insurance Agency to achieve universal health coverage.
Will the new law be in sync with the 10-year strategic plan document drawn up by the NHIS? Dr. Kurfi, who chaired the committee in charge of drawing up the strategic plan, speaks on that.
The 10-year strategic plan is actually a long-term projections, a projection of how the NHIS intends to move Nigeria towards UHC. And in the wisdom of the ES CEO and other stakeholders who developed the 10-year strategic plan, already envisioned that a day like this will come, where this act will be passed. And so this act is an enabler for the attainment of UHC in Nigeria. So the act will go a long way in actually fast-tracking the implementation of the 10-year strategic plan.
One thing that was common to every participant was that the retreat provided an avenue of gaining in-depth understanding of the new act.
Looking at the new act, and how we will be transiting from what we used to be, the National Health Insurance Scheme, to the new National Health Insurance Authority. So what we're doing essentially is looking at the new act, clause by clause, with the aim of gaining in-depth understanding of what the new act has now empowered us to do in terms of functions. Importantly, the new NHIS is going to be one that will be promoting, integrating, and regulating the health insurance ecosystem in the country.
What is happening here is there are certain portions that needs further knowledge of how to operationalize the act. So this retreat is very, very important, because if you look at the ecosystem, there are many documents that are flying to be as the act. Meanwhile, most of them are not what is supposed to be used as a working document or the gazetted document of the act. So what we are doing here is to explain further, so that the ecosystem stakeholders, users of this act, players in this ecosystem will be able now to use it in its simplest form without any ambiguity.
You have heard from participants of the retreat and how they perceived its importance in the implementation of the new National Health Insurance Act. Up next, your questions answered. Do stay tuned.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
Question: why do enrollees think NHIS drugs are substandard?
It's a perception issue. And if you really want to answer that question, you need to do some historical background to our health perception of drugs in Nigeria generally, not under NHIS alone, where people perceive that branded drugs are the original drugs. So the term generic it doesn't connote inferiority. It doesn't connote substandard drugs. It does not connote fake drugs. Rather, it talks about the pharmaceutical elements that are actually necessary for drugs are present in that particular drug. For example, a company can brand a drug, can through innovation bring out a drug, and because of what they have spent in creating that drug, the systems allow them to keep patency for a certain number of years, which means other companies cannot manufacture that drugs. But once that period is over, other companies can now come in and manufacture the same drug, the same standard, the same quality.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled?
How can I get enrolled?
I think I paid almost nothing.
It went easy. We only paid 10%.
We all work towards accelerating universal health coverage.
Everybody, irrespective of his gender, has access to basic healthcare services.
NHIS.
And so, we draw the curtains on this week's episode of the program. You have a responsibility in helping Nigeria attain universal health coverage by ensuring that you and your loved ones are covered by one form of health insurance or the other. Find out how and get enrolled today. See you next week.